Dear friends, good evening. Hope you're all doing well. This evening, IBPC brings to you a very interesting topic. How can we reshape the world economy through global health? And we have a very interesting keynote speaker today, which we will have one of my colleagues to introduce him. During this time, Corona has forced us all to buckle up, sit tight, know where to go, but be healthy. And it has brought us some significant changes to our lifestyles, pushing us to adapt. All that is digital. I will now request Ms. Anant Kapadia, IBPC Honorary Chairman, to start this evening's function. Thank you and have a good evening.
Thank you, Choji. Good evening, His Excellency, the Ambassador of India, Sri C.B. George, keynote speaker, Dr. Srinath Reddy, ladies and gentlemen, a warm welcome to you from IBPC. This is our second webinar in as many months after the COVID lockdown. As much as we wish that the keynote speakers were present amongst us in person, but for the COVID protocol, we are left with no options but conduct virtual events. We are determined to continue with our yearly calendar of interesting events despite the limitations we face. I would begin by offering our deepest condolences to the family and leadership of Kuwait on the passing away of a beloved leader, the late His Highness Sheikh Sabah Al Ahmed Al Jaber Al Sabah. He was a true well-wisher of India and the Indians in Kuwait. In his honor, I wish to dedicate this seminar to all the citizens of Kuwait. Ladies and gentlemen, I take this opportunity to mention that Padma Bhushan Dr. Srinath Reddy is my good friend from Hyderabad, and our association dates back to our college days of the early to mid 1960s. Not only was he a brilliant student, but an excellent debater and orator, winning all kinds of awards and prizes. As students, we had traveled together to Delhi to participate in the Students' Model Parliament, where he left a lasting impact on all the participants. With a bag full of career and professional achievements in his fold, Dr. Srinath remains a very humble person, no different from when he was a college student. On behalf of all of us, I thank Dr. Reddy for making himself available for this webinar, despite his extremely tight schedule. I thank our Kuwaiti brothers and sisters and the office bearers and members of various Indian associations, including Indian Doctors Forum, CA Chapter, IIT IIM Alumni Association, Kuwait Engineers Forum, and various regional associations and other guests for participating in the seminar. We hope you will find the seminar educative and interesting. Some of our interviews and events were aired on Kuwait TV in the past, and we shall continue this trend in the future also. Kuwait TV has expressed its wish to have an exclusive interview with Dr. Srinath Reddy to be aired live on Kuwait TV in a few days from now. Before I invite Mr. Kaiser Shakir to introduce the keynote speaker, I request our ambassador, Sri C.B. George, to please address us. Thank you all once again for attending the webinar. Have a good evening.
Go ahead.
President of Indian Business and Professional Council, Sri Anant Kapadia, keynote speaker, Dr. Srinath Reddy. Ladies and gentlemen, good evening. I begin my remarks today expressing my heartfelt condolences on the sad demise of His Highness Sheikh Sabah Al Ahmed Al Jaber Al Sabah, as this is one of the first major events that an Indian organization in Kuwait is organizing after the passing away of His Highness. We are now in the middle of a mourning period where a grateful nation mourns the demise of his beloved leader. During these difficult times, we Indians in Kuwait also mourn with our Kuwaiti brothers and sisters. I also begin by thanking His Highness Sheikh Nawaf Al Ahmad Al Jaber Al Sabah, the new Amir, and His Highness Sheikh Mishal Al Ahmad Al Jaber Al Sabah, the new Crown Prince, for hosting the large Indian community in Kuwait and for their leadership in strengthening the bilateral relations between our two friendly countries. I thank the IBPC team for the initiative in organizing this webinar on this important topic: how can we reshape the world economy through global health? I'm happy to see that we are joined today in this webinar by senior businessmen and distinguished professionals from all over Kuwait, representing several important sectors. When we attend this important event here in Kuwait, another important event is taking place in another part of the world, when the second largest democracy in the world is in the middle of elections, in the middle of concerns of health and economy. In India too, we had elections in a few states today. In fact, the interconnected topics of how to safeguard public health and at the same time keep the economy growing have become major concerns of almost everybody today. Every country, every government, both central as well as state governments, every business enterprise, big and small, and even every family today. The COVID-19 crisis, which began as a health challenge, has evolved into an economic disruption, a geopolitical shock, and a global challenge of a magnitude that humanity has not experienced since World War II. To quote External Affairs Minister Dr. S. Jaishankar, who said in one of his major addresses recently, one of the consequences of this most catastrophic global development will be that those living in extreme poverty will increase for the first time in a quarter century. But there are other results as well. Among them, how countries perceive national security and global trade so much more differently than before. The additional stress on the global system will surely aggravate its already difficult predicament, unquote. It is in this context that I look forward to listening to our keynote speaker, Dr. Srinath Reddy, on the topic, how can we reshape the world economy through global health? In India, we are addressing the challenges on economy and health through a multi-pronged strategy, including through the Atmanirbhar Bharat campaign that the Prime Minister announced. These announcements by Honorable Prime Minister are a stimulus, big stimulus to the economy, particularly to small businesses and the informal sector. Let me quote from an interview that Honorable Prime Minister gave recently. I quote, "We saw how a new world order was formed after World War II. Something similar will happen post-COVID-19. This time, India will ride the bus of manufacturing and integrating its global supply chains. We have specific advantages in the form of democracy, demography, and demand," unquote. Referring to India's health sector in particular, Prime Minister said, India's pharma sector, during the past few months, has already demonstrated the way ahead. India has emerged as a key player in global pharma supply chains. We have become the second largest manufacturer of PPE kits in a very short duration. India is also making a mark in manufacturing technologically advanced items like ventilators, and from almost negligible capacity earlier, we are now manufacturing thousands of ventilators in quick time. Now that we have successfully established this model, we can emulate it in other fields. Our recently launched PLI, Production-Linked Incentive schemes for mobile manufacturing, pharmaceuticals, and medical devices are good examples of this focused and targeted approach to attract internationally reputed investors to create capacities with global scales and competitiveness, as well as make India their export hub. According to Moody's, 154 greenfield projects from the US have come to India in 2020, compared to 86 in China, 12 in Vietnam, and 15 in Malaysia. This is a clear indication of global confidence in India's growth story going forward. Let me conclude with what Prime Minister said about Atmanirbhar Bharat. He said, and I quote, "When we say Atmanirbhar Bharat, we mean an India that is first of all self-reliant. A self-reliant India is also a reliable friend for the world. A self-reliant India does not mean an India that is self-centered. When a child reaches the age of 18, even the parents tell him or her to become Atmanirbhar. This is natural. Today, we are using our Atmanirbharata to help the world in the medical field. For instance, we are producing vaccines and drugs without increasing costs or putting restrictions. A relatively poor country like ours incurs a huge cost to educate doctors who are today spread across the globe, helping humanity. We never stop them from migrating. When India becomes Atmanirbhar in a certain field, it always helps the world." Unquote. One of the best examples of our Atmanirbharata is the presence of large number of Indian doctors and medical professionals in countries like Kuwait, larger Gulf region, where they are actively involved in fixing health, thereby contributing in reshaping the economy of the region. There are several key areas such as energy security, ICT, trade and investment, infrastructure development projects, healthcare, automobiles, petrochemicals, and education, where there exists huge potential to broaden our long-standing partnership and further establish our Atmanirbharata. I invite you to join the various events, including a few business webinars that the embassy has lined up in various chambers with various chambers and export promotion councils in India in coming weeks and months. I once again thank the leadership of Indian Business and Professional Council for organizing this webinar. I look forward to the keynote address by Dr. Srinath Reddy. Thank you.
His Excellency Ambassador of India to Kuwait, Mrs. C.B. George, members, distinguished guests, ladies and gentlemen. This evening, the task of introducing our keynote speaker is indeed a great privilege. I feel elated to introduce him to everyone. I know this one is difficult, especially given the fact that the list of his career achievements, contributions, awards, and orations is too long to fit into a few minutes. If one takes a closer look at the alchemy of this luminary, two distinct virtues pop up, besides perseverance and hard work. These are pioneering spirit and willingness. Our speaker today is a living idiom of a person who is on the crest of a wave and made inroads into his field of expertise. Professor K. Srinath Reddy. Professor Reddy is the President of Public Health Foundation of India, PHFI, and formerly headed the Department of Cardiology at All India Institute of Medical Sciences, New Delhi. Under his leadership, PHFI has established 5 Indian institutes of public health to advance multidisciplinary public health education, research, health technologies, and implementation support for strengthening health systems. He was appointed as the first Bernard Lown visiting professor at cardiovascular health at Harvard School of Public Health in 2009-2013 and presently serves as an adjunct professor of epidemiology at Harvard 2014 to 2023. He holds advisory position in several national and international bodies and recently published a book, Make Health in India, reaching 1 million copies, million plus rather. He is also an adjunct professor at Emory and Sydney universities. He is the first Indian to be elected to the National Academy of Medicine USA and was awarded several prestigious international and national doctorates and fellowships. He was president of the World Heart Federation 2013 to 15. He has served as physician to 2 prime ministers of India and is a member of the Government of India's Technical Task Force for COVID-19. He is also an advisor on health to Government of Odisha, Punjab and Andhra Pradesh with the rank of a cabinet minister. Last, but definitely not the least, is the Padma Bhushan awardee. Ladies and gentlemen, let me invite a scholar, professional, civic and business leader, internationalist, writer, and a prolific orator, Dr. Srinath Reddy. Thank you, sir. Over to you.
Thank you. Good evening. Assalamu alaikum and namaskar. It's indeed a great privilege to be part of this event. And while COVID is keeping us apart, I believe we are closely knit in our bonds, both in terms of friendship across nations and also unified in our fight against a public health emergency which is proving to be a global threat. Indeed, the kind of public health emergency that has been foisted upon us has been unprecedented, at least over the last 1 century. After the flu of 1918, the pandemic flu, which claimed a very large number of lives, we have not had a public health emergency of this magnitude. And this has had not only a public health emergency confined to COVID-related deaths and disease, with over 1.2 million deaths already claimed. But apart from that primary public health emergency, we are also seeing a secondary public health emergency of many other health conditions which are getting neglected per force because the health system is busy grappling on the COVID front, and therefore some of the essential needs of maternal and child health, other infectious diseases like tuberculosis, non-communicable diseases like cardiovascular disease, diabetes, and cancers are all currently not getting the kind of attention they need. So we are going to see the cumulative effects of both these public health emergencies as a result of this pandemic. But one of the greatest adverse impacts has been on global economy, which has been pushed into the sick bay by this virus. The International Monetary Fund declared in May itself that of an unimpeded epidemic in Europe and in North America and elsewhere where there has been some degree of resistance and success. Nevertheless, there is still the dread of a second wave coming up. So we have not seen the end of this epidemic, and already the economy has been considerably devastated. Whether we are going to have a V-shaped recovery or a U-shaped recovery has been the subject of considerable debate. But that's a debate best put off till we are sure that we have some measure of success in combating this pandemic. Even now, we are still fighting to some extent globally with our back to the wall, though I must say India has at the moment achieved a fair amount of success in stemming the number of cases as well as deaths. But COVID-19 has definitely been a global shock to the economy. Firstly, on the supply side, the infections reduced labor supply and productivity. Lockdowns, business closures, and social distancing also caused supply disruptions. On the demand side, you have layoffs and loss of income from morbidity, quarantines, and unemployment. And fear of infection also keeps people from engaging in purchasing several needs, some of them essential, but some of them discretionary. Whether it is purchasing of different types of foodstuffs, or going to a hairdresser, or undertaking travel for vacation or business, we find that the demand has remarkably slowed down. And this demand depression and high unemployment further slows down the supply side, creating a vicious cycle. And there is extreme uncertainty about the path, duration, magnitude, and impact of this pandemic at the moment. And all we can say is that at least till the first quarter of 2021, the world is not likely to see a clear picture of relief from this pandemic, and we still have to be very much on our guard. And we recognize that no country has really been totally immune to this, even in terms of the economic impact. There are a few countries that have escaped the fury of the epidemic, but they're very small, both in size and number. But a country like Sweden, which decided to buck the trend of lockdowns or social distancing substantially, could not escape either the brunt of the pandemic in terms of deaths or even protect its economy fully, because when you are surrounded by countries which have gone into a lockdown and where the economy has taken a nosedive, you cannot expect to be isolated in that turmoil in terms of protecting your own economy. The interdependence of global health and of the global economy has been so vividly brought forth in this pandemic. The world indeed is a very small place in terms of its vulnerability. We recognize that non-Asian emerging markets are particularly vulnerable, though emerging Asia has the best prospects in the near term in terms of economic recovery. But nevertheless, global economy is so integrally linked and unified now that we have to look at any dangerous trend anywhere as potentially threatening the economy as well as health elsewhere. So what we need is a comprehensive, coordinated, cross-country policy response with an immediate focus on containing and reversing the epidemic. We need swift deployments of medical resources, including vaccines when available. We need policy interventions that can restore normal functioning of financial markets, measures that can support firms and households. But we also recognize that when the vaccines do come, if they do come, the global supply will be really meeting a very high level of global demand. No other vaccine has really required to be administered to virtually everybody in the world. And therefore, that again, in turn, calls for a high level of global investment. So we recognize that there is a level of shared vulnerability, which the globalization of health and the globalization of economy has brought forth. But at the same time, it is shared values which go beyond shared vulnerability that must bring us together into a collective response which provides a global thrust against a global threat. Now, that is an immediate necessity. But we are also talking about a revival, and it is necessary to retain that optimistic vision even at the moment when we appear to be on the back foot. Because we recognize that even after the 1918 flu pandemic, which claimed 50 million lives, the world economy did bounce back. Even after the Second World War, the world economy did bounce back. So there is definite hope for revival. But we also recognize that this revival must happen on different lines than business as usual, both in terms of rebuilding our strengths in health as well as in ensuring that our economy does not become vulnerable because of failures on the front of public health. Therefore, we need to reimagine the relationship of health and economy, both in the national context and in the global context. But for this, we have to go back a little way back to see why health has been neglected in the context of economy and what we can do to redress that neglect and build a far healthier relationship between the two. Over the 20th century, or much of it, health was seen as a passive beneficiary of economic development. It was thought that as countries increase their per capita income in terms of their developmental benefits, the health of the people will increase, as clearly denoted by increasing life expectancy. And this is a relationship that was brought about by what's called the Preston curve, which showed that countries with low per capita income, as they sharply increased their per capita income, their life expectancy indeed increased, but up to a certain point. By the time the per capita income reaches about $5,000, the relationship plateaus and there is no major additional benefit of an increasing income. But nevertheless, it's important for us to ensure that the economic levers of that growth, particularly for low and middle income countries, are active so that we gain the benefit of increased life expectancy and preferably increased healthy life expectancy, where not only we gain years, but we also gain years of healthy life. But a caution was thrown by Wilkinson and Pratt in their book Spirit Level, also supported by many other research studies, which showed that it is not just the amount of economic growth that matters, it is also the level of equity in society. Countries with a high level of inequity do not gain as much from their economic growth as countries with a higher level of equity. And this is true between countries and within countries that we see these disparities happening. And for example, if you look at countries with relatively narrow band of inequity, where the inequity gap is not very wide, then the same level of per capita income gives much better returns in terms of health, life expectancy, healthy life expectancy, and a variety of other social indicators than countries with the same level of per capita income, but with a wide gap in equity. And even among the OECD countries, the gap between Japan and the United States of America is very clearly visible. And a number of other OECD countries also demonstrate that. So even as we pursue our road to economic recovery and accelerated economic growth, we must recognize that the equity gaps must not be allowed to exist. And as His Excellency the Ambassador clearly pointed out, that one of the dangers of this pandemic is growing inequity, and that is something that needs to be addressed as we take the path to economic recovery. But even beyond this, there was also a certain degree of neglect of health as an important element of economic growth, because it was far too long believed in the 20th century that health is a passive beneficiary of economic growth. As the economies grow, countries become more prosperous, the people's health will automatically improve. It does to some extent, but it is also true that health is also an important investment for accelerated economic growth. There is a bidirectional relationship, not a unidirectional relationship. That is at the population level. Individual level, there is a similar bidirectional relationship between poverty and ill health propels people into poverty, and poverty perpetuates or precipitates ill health. So we do need to address all of these in terms of the relationship between health and economic growth as we are rebuilding forward. Some of this has been pointed out by the Nobel laureate economist Kenneth Arrow quite long back, but nevertheless, there was a dominant view espoused by a very celebrated economist who was very influential for much of the second half of the 20th century and even for the first 10 years of this century, that is William Baumol. Baumol said investment in healthcare is a cost disease. Unlike other investments, increased investments do not yield increased returns. Over a period of time, the costs far exceed the investments, and therefore it's not an optimal investment. Though it may be necessary for social reasons, and for economic reasons, it should be seen as a cost disease. That is his terminology, and that did persist for some time. as the dominant view. But this was challenged not only by Kenneth Arrow, but the World Bank in 1993 brought out a report called Investing in Health, led by two economists, Dean Jameson and Larry Summers. And they pointed out that it is important to invest in health even for promoting and protecting the economy. There were some distortions in that report, but nevertheless it had an impact. Then in year 2001, the Commission on Macroeconomics and Health, set up by the World Health Organization and led by Jeffrey Sachs, came up with a much more resounding report, very well reasoned as to how investments in health are absolutely necessary for a healthy economy. So that relationship of health as an accelerator and a lever of economic growth was very clearly enunciated there. In 2013, the Lancet Commission on Investing in Health, again led by two world famous economists, again came out with a report and said that in the 21st century, preceding in the 12 years preceding that Commission's report, 11% of the economic growth in low and middle income countries was entirely attributable to improvements in health and investments in health. And it pleaded that there should be much greater investments and promised excellent returns. The Commission said that for every dollar invested, low-income countries would get $9 of returns of investment, and middle-income countries would get $20 of returns on investment if that investment is made. And it also cautioned that there would be 10 million deaths prevented by 2035 if these investments are made, but otherwise there would be that lost to life as well. And it also pointed out that there is a huge value to life which is not usually costed in health economic analysis. We recognize that health has both intrinsic value as well as instrumental value. The intrinsic value comes from a person's well-being, the ability to participate in sports, lead a healthy family life, including a conjugal life, to meet with friends. All of that is actually the intrinsic value of health. The instrumental value of health comes because health enables you to access education and benefit from it, to gain an occupation and work well at it, to gain an income and social status. It helps you in your creativity and productivity. So for both the intrinsic value of health and instrumental value of health, it has a definite bearing on the economy of a country and not merely on the economic status of an individual. But we recognize that health has many determinants. There are the biology, beliefs, and behaviors which operate at the individual level, but there are also social, economic, environmental, and commercial determinants which operate at the broader societal or population level. And health conditions do not exist in isolation. They often overlap. Not only maternal and child health and non-communicable diseases and infectious diseases exist as important buckets, but they also overlap considerably. Who are the people dying mostly of COVID? Who are the people most at risk of getting a very severe illness? They are the people with non-communicable diseases, with hypertension, cardiovascular disease, chronic respiratory disease, or on cancer chemotherapy. Apart from the elderly who also have more of these high comorbidities, people at younger ages with these comorbidities are also getting highly vulnerable. So you cannot tease out one disease from another, and therefore the determinants of all of these causes of ill health have to be addressed from a societal perspective. And that therefore it cannot be just hunting the virus with a drug or a vaccine. All of these will have to be taken care of, because another flu will come, another respiratory virus will come, and again claim these people with increasing levels of diabetes or blood pressure or chronic respiratory disease. So as we are reshaping our future, we need to see health as an investment in our economy, in our societies, in our social stability, and as a global public good. and we have to invest in health as a global public good, not just as a private need. And recognizing also that health is a very important employment generator, where automation is greatly reducing the jobs in industry, service sector, and even in agriculture. It is the health sector that is the biggest employment creator in the future. You will not be able to do physiotherapy with a robot. You will not be able to do a fair amount of medical health care or medical care with the help of a robot. So you have to have a lot of people, even if you're going to go for some degree of automation in the health sector. The health sector is going to be creating the largest number of jobs with a certitude that is not available in other sectors. And this is not me speaking. This is a commission of the United Nations, which was set up and which gave its report in September 2016, headed by two former presidents, President Hollande of France and President Zuma of South Africa at that time, but also having several other distinguished members. And they clearly said that investing in health workforce is one of the best investments you can make for the global economy, not only to provide better health through the health sector, but also to provide better economy, particularly for young people and women who are yearning to get into the labor market, and particularly for countries with a huge demographic bulge, where number of young people are job seekers. The health sector is going to provide one of the most important elements. And then we recognize that as we move towards universal health coverage, which is one of the important targets of our sustainable development goals, the world is really short of healthcare workers. At the time of the Millennium Development Goals, it was said each country requires 22 health workers, that is doctors, nurses, and midwives per 10,000 population. But with the Sustainable Development Goals and universal health coverage providing for a larger package of services, the WHO revised the recommendation to 44 health workers per 10,000 population. And we are grossly short of this. And it is said that we will be requiring about another 18 million healthcare workers by 2030 if we are to reach that goal. And this is an opportunity for creating jobs and thereby not only boosting our economy, but reducing the inequities in society, particularly allowing women to enter the workforce in much larger numbers. And therefore, we need to address all of these. We need to address the environmental determinants of health by reducing pollution and by combating climate change, because we recognize even COVID is going to kill more people in polluted environments. We have seen that all around the world. Therefore, all of these actually interact together. It's not one pandemic, it's a multiple pandemics together. It's a syndemic. And that's why we have to look at all of these interconnections. We have to address the environment and reducing the air pollution, slowing down climate change, and we must control the commercial determinants of health, whether it is tobacco or alcohol that are being aggressively marketed. Finally, let me say, on a more positive note, as His Excellency the Ambassador has already enunciated, that India can offer a fair amount of positivity in this area, particularly in terms of enabling economic revival through the health sector, apart from all the other economic investments that can be made. Why? Because India is demographically very young. It can contribute a much larger health workforce, not only to meet its needs, but also the needs of the world. Many societies are aging, and their population will require a health workforce which they themselves will not be able to create. And therefore, India can, apart from satisfying its own needs, meet the global health workforce needs if there is investment, if there is sufficient investment in that. Again, health technologies. India is already producing a number of innovative health technologies and frugal technologies at that, for primary health care as well as for other purposes. And particularly with Atmanirbhar, after the pandemic, there has been a push for even producing some of the more sophisticated technologies as well. But this push for health technologies, which are very affordable, is eminently possible in India, particularly frugal technologies. And remember, again, young people are the most creative, and with its wealth of young people, India will have the ability to produce the kind of technologies that are needed. Again, that requires investment. And that investment will yield returns not only for India, but for the world. Then India will also be able to produce green technologies, which is going to be the way of the future. So I believe it is absolutely important when we are looking at the global investment climate to look at India as a potential investment opportunity, not only for benefiting India, but for benefiting the whole world through the products that we can create. So what we need is co-production of global health. Let us remember, everybody is vulnerable. No country is safe till every country is safe, whether it's a pandemic or if it is an economic crisis. Therefore, it's important for us not only to join hands together to protect the global economy, but we need to become partners in the co-production of health. Doesn't matter where it is. You can invest in India, but the benefits will reach the rest of the world. And we will certainly require this kind of international funding, even for production of vaccines. We are producing vaccines in much large capacity, and we have that capacity. But if you have to reach the entire world, you require a much larger investment in accelerating the production or even expanding the production. His Excellency the Ambassador did speak of the Prime Minister speaking of Atmanirbhar. But the Prime Minister of India also spoke of Vasudhaiva Kutumbakam. The whole world is a family. And it is with that philosophy that we must recognize that it is not only the perils of a shaken global economy that must bring us together in a huddle, but it is the optimism that global health can actually provide the platform for rebuilding a healthier global economy that must bring us together. Toni Morrison, the Nobel laureate who got the Nobel Prize for English and who passed away recently, she said or wrote, "If we do not create the future, the present extends itself. We cannot afford a passive response. We need an active response, because not only the present will extend itself, if we are passive, the future will be worse than the present, and we cannot and should not allow that to happen." So it is absolutely important that organizations such as the Indian Business and Professional Council in Kuwait not only look at what's happening in Kuwait, but also look at how the world itself must be reshaped and also provide appropriate support to India in contributing much more effectively to that process. Thank you very much for this opportunity.
Good evening, friends. Dr. Reddy, that was truly a very insightful talk that you have given on India's situation, with the Atmanirbhar action that our Honorable Prime Minister has undertaken. And really, I think this is an endeavor which each and every individual must undertake, to promote India, because India certainly has the brains, the sort of access to technology, the know-how, in each and every field, engineering, biology, medical, everything. And truly, India can really contribute. I mean, we can see Indians individually, the contribution globally, in every country or every geographical area of the world. So, and you have connected that very well, to the health that, of course, we have to look after, but also what it can offer, India can offer to the world. Thank you so much. Now, I think let's take some questions and answers from the public, and I'll put you back on, Dr. Reddy. Thank you. Okay, Dr. Reddy, there is a question from one Mr. Ramesh Khanna from Kuwait. He says that, do you believe this epidemic is Malthusian theory of population, the current level of world population is far beyond what the Earth can sustain?
Okay.
Yeah.
Well, I do not believe it's entirely Malthusian in the classical Malthusian concept, because Malthusian concept was essentially related mostly to the outstripping of food supply, and our technology is still able to do it. But there is another fundamental reality. We have been flagrantly violative of the ecological balance. Growing population, of course, does also pose a threat to ecology and environment, but it is not as much at the moment on the question of what's happening in terms of the large population outstripping the food supply. It is because we have created conveyor belts between the forest-dwelling viruses and vectors, captive veterinary population being bred for human food, and between the human habitat. These viruses have generally been relatively quiescent in their primary host in the forest. But when they have access to a very large captive bred animal population or the very large and mobile human population, they can afford to get much more virulent as well as much more infective. And we have actually created those kind of conveyor belts with extensive deforestation for either urbanization or for agriculture or for mining. And it is these processes that we must learn to control now. In the last half a century, more than 2/3 of all new infectious disease outbreaks have been zoonotic, from animals to humans. That's not because animals have suddenly become malevolent towards human beings. It is because we have created the pathways for these diseases to spread. So that is why we must be much more careful about how we plan our future in an ecologically sustainable manner.
Right. Dr. Reddy, next question is from one of our very dear friends, Ram Mohan Reddy. He says, seeing the fleecing of private hospitals in all major cities of India during the pandemic, don't we need an independent health regulatory authority that can ensure some good order in the commercial hospital industry?
Absolutely, there's no doubt about it. We need much stronger regulatory structures, and they're actually being established. But we also need the public sector to be strengthened much more, because in a mixed economy which has grown by default rather than design, the private sector has grown to occupy a lot of space, particularly in tertiary care and some elements of secondary care. We need the public sector as the counterfoil to set quality and cost standards, and we cannot afford to have a weak public sector. Ultimately, we have to take into account all the resources available in the country, public, private, and voluntary sectors, into the framework of universal health coverage, but that has to be a well-regulated framework in which the deliverables and accountability are very clearly defined. But I fully agree that we do require much better accountability from the private sector.
Okay. Thank you, Dr. Reddy. There's again from our friend Ramesh Khanna. Will it be possible to forecast and control such epidemics in the future with developments and research in artificial intelligence?
Yes, I believe artificial intelligence is going to be helpful, for example, in forecasting some of the trends, bringing big data together into what is called eco-surveillance or One Health, to see how the viruses are tracking from wildlife to veterinary population to human population. Artificial intelligence has been used also to develop new drugs. So there are a number of ways in which we can actually use artificial intelligence. But artificial intelligence can only supplement and support what we do. If we continue to be violative of the ecological balance and we continue to have obesity levels and diabetes levels and coronary heart disease levels rising because of our living habits and the commercial determinants of health, then artificial intelligence will only come in essentially as a pallbearer rather than as a savior to begin with. So I think artificial intelligence cannot be a substitute for natural intelligence. The natural intelligence must utilize artificial intelligence appropriately.
True. One last question we have is, do you think there would be long-term consequences to the COVID affected?
Well, at the moment, it appears that COVID is not an acute problem alone. It is actually in a substantial number of people is leaving some longer effects, in some cases lasting a few weeks, some cases going even up to months. Because it's a new virus, we still have to really gauge how long these effects are going to last. We know, for example, that the so-called long COVID has been affecting people who are now known as long haulers. And this has resulted in chronic fatigue is one of the most usual symptoms. But we are also seeing effects in the lung with continued breathlessness and even lung fibrosis in the X-ray and CAT scans. We are also seeing with imaging techniques damage to the heart with the myocardial fibers being destroyed by the virus, and also some of the manifestations of the immune response in the body also affecting different organs. We are seeing things like diabetes happening because the pancreas has been affected. We are seeing the brain being affected. We are seeing a number of course, venous thrombosis happening, which is affecting the lungs and the heart. So there are a number of manifestations that we are seeing which are passing either from the acute phase into the subacute phase or even into the chronic phase. And we still have to study this much more to see what proportion of people are going to have this, for how long, and what is the best method of handling it. And particularly because much of this is going to be affecting people who are discharged from the hospital, we need to strengthen our primary healthcare services to recognize this better and to manage it better.
Right, for sure. I have a question. I don't have any more questions from the audience, but I have a question.
Anand seems to have a question.
Okay, Anand, you go first. Go ahead.
Yeah. Dr. Reddy, there are several theories making rounds. What is your opinion about this COVID virus being man-made in China, in the lab?
Well, I think enough number of scientists have explored that theory, and at least the overwhelming consensus among reasonable scientists is that this could not have been man-made. It might have escaped from a laboratory after having been isolated from wild animals and while being studied, but at least the creation could not have been man-made. That is the overwhelming consensus.
Thank you.
Yeah, Dr. Reddy, so my question was, now, a lot of very proactive research is going on in developing the vaccine for corona. Honestly, I'm not a doctor by any standards or anything, but to me, it doesn't seem possible that they will actually come out with something for a very long time. Not maybe, there is always this chat about on a few months, clinical trials are going on, something is happening, but my personal thought is this really going to happen? I mean, it doesn't sound very, because they're still not able to control the nature of this or understand the nature of this whole corona story. So many manifestations, the side effects it creates.
Well, let me take a couple of minutes to explain the vaccine story, and I'll answer your question certainly at the end of it.
Sure.
For any vaccine to be useful, it has to be effective, it has to be safe, and it has to have a reasonable duration of action in terms of protection. Safety is always a big issue because you can have a problem in terms of what is called antibody dependent enhancement. For example, in SARS-1, and that SARS-1 virus is very much like the SARS-2 virus, there was a lot of antibody enhancement for the vaccine that was being prepared. That means the vaccine itself creates a fair amount of immunological reaction and enhances also the entry of the virus into the cells. So we have to be very careful. So far, the trials have not shown any such thing. But we still have to have larger numbers to assess the safety fully. Then the question of efficacy. It is also known that vaccines sometimes, which are using fragments of a virus, may protect only against the fragments of the virus, but not against the whole virus.
Correct.
So that's called the original antigenic sin. Now we have to make sure that that's not a problem either. So that's why we need the phase 3 trials to be completed. Now the duration is the big question that you have asked. Even if we have a safe and so-called efficacious vaccine, is it going to be producing antibodies which disappear in 3 months, or so what's the use? But now there is increasing evidence that there is cellular immunity, which seems to last at least up to 6 months, if not beyond. As I said, there's a new virus. You really don't have too many people who can be studied long, but just today it's been reported, or yesterday it's been reported, that a substantial number of people seem to have a T-cell immunity up to 6 months at least. So that is at least reasonable. Now you may say, what's the use of 6 months? I want at least for 2 years or 3 years. But
right.
Even if you get a vaccine which can protect you for 6 months, that can break the transmission cycle. And not only protect the vulnerable, but break the transmission cycle. So while ideally I would like to see a vaccine which has at least a 2 to 3 year protective effect, but this, if it lasts even 6 months, that gives reasonable hope. But we still have to wait for the trials to complete their phase 3. So far, only some of the trials are in phase 3, some of them are in phase 2. We'll have to wait then. We are utilizing science to research these vaccines, but we are investing in hope. We'll have to wait and see whether those investments in hope will pay off or not.
Fair. Okay, we do have, I thought that was the last question, but we do have 2 more attendees, if you don't mind answering them, and then I think we can call it fair. Okay. Dr. Sudhakar Tandavali has asked that I feel India should have a strong primary care system in the model of general medical practice in the UK, free at the point of delivery. I'm saying that in the UK they have it free at the point of delivery. Is it possible to set up a similar system totally funded by the state in India?
If I can break into Hindi, and if I was not a cardiologist, I would have said, "Aapke muh mein ghee shakkar." I entirely agree with you. I fully agree with you. What we need is a very strong primary healthcare system. Absolutely, because that's fundamental for any well-functioning health system, which has to be efficient and equitable. Even for universal health coverage, that is the primary base, because everybody needs primary health care sometime or other in his or her life. Secondly, that provides the widest bundle of services. It is also the most cost optimizing element of the healthcare system. But the primary healthcare has been unfortunately neglected, particularly urban primary healthcare has been virtually absent in an organized form, and rural primary healthcare has been there as a design but not well delivered, except in a few states. Like, for example, Tamil Nadu has an excellent primary healthcare system, fully state funded. Kerala has too, an excellent primary healthcare system, which has even further improved over the last few years, which is again state funded. But I believe primary healthcare system should be fully state funded. Under the Ayushman Bharat scheme, now 150,000 health and wellness centers, which is going to be done through upgradation of health and sub-centers as well as primary healthcare centers. That is there, and that is to provide comprehensive primary healthcare through the public sector. So definitely there is a move towards recognizing, and even the National Health Policy of India says that while increasing our public financing of health to 2.5% of GDP, 70% of that will have to be spent for primary healthcare. If that truly happens, then we will have a much better primary healthcare system.
For sure. And last question from our friend Suresh is, do you think the World Health Organization is getting involved to get all countries to work together in this circumstance? Or do you think their efforts are there efforts in the right direction?
Well, remember that the World Health Organization, like all other UN organizations, is an organization of member states. Its agenda and priorities are set by the member states. There are, of course, techno-bureaucrats who will try and deliver on that agenda, but the agenda has to be shaped by the member states. And the WHO will try its best. Some countries will listen to it, some countries will not listen to it. And of course, some of the countries which have been financing it at a high level want their own voice to be heard. So those politics will be played in any UN organization as in any other forum. But having said that, because it's a membership organization, the low and middle income countries can exert their influence on many of the decisions if they stand united in the General Assembly or and they can get the in the World Health Assembly and they can reset the mandate.
Right. Well, Dr. Reddy, thank you so much for your really insightful sharing of your thoughts. It'll be wonderful, to listen to you. I will have, I mean, if we can spend more time, it'll be wonderful to listen to you because a lot of information there. Thank you so much. You have a good day, and thank you all the attendees for participating. Thank you, Anand Saab, Ambassador George, and Kazir Bhai for the introduction. Thank you all.
Thank you very much, and
thank you very much.
My greetings to the ambassador, and my particular thanks to my Hyderabadi friend Anant, who always traps me with love into accepting any invitation that he extends, which I cannot refuse. Thank you very much. It's a pleasure. Thank you.
Thank you, sir. Thank you. All the best.